Okay, this is the time of our, attendees to have, in case they have any questions, you may ask them freely. You can step up to the mic, raise your hand in case you have any question, please. And I cannot see hands, maybe because the lights are in my face, but just shout out. Yes, we have a question here.
Assalamu alaikum. Thank you so much for your talk and excellent presentations. I have a questions for Dr. Abdullah Mashi in regard of post-donation and donor notifications. What do you think the most challenge that facing when we notify donors in regard of follow-up and follow the regulations of quality?
Thank you, Dr. Moussaad. Well, there are actually many challenges, but I would, from what I see, when I do conduct a Sibah survey, and maybe Abu Abdullah also has seen the same thing, is that it's actually the process. Sometimes we don't have the right donor contact details. Either the mobile is not correct, and once there is no mobile, there is no other means. So we don't usually take the emails, we don't take the correct address. So this is really one of the most thing you find, that you cannot reach the donor. Sometimes when you call the donor, also you find maybe the phone is with somebody else. It's not even belong to the donor, or for his father or brother. So you cannot reveal any data to these people. Also, there is no actually a specific and structured way of what I should tell the donor when I call him or her. It depends on the experience. Sometimes it's conducted by a physician, sometimes conducted by a laboratory specialist, and sometimes it's not conducted even by the blood bank. They will just send information to like preventive medicine, and they will handle this. And we don't know exactly how they are handling it, whether it was really appropriate or not. So I think, there are a few things that we need really to improve in this. But this is, I would say, the most important.
Do you think the unique national systems, link all the hematos, for example? I heard today, this morning, that hematos is now live in most of the blood bank around the kingdoms, and it comes by time all the MOH blood bank should be covered by hematos. Do you think link them with Sadaya or Abshir, that will solve this issue in regard of communications, donor communications?
Yes.
Thank you.
Yes, of course. If the data of the donor is extracted from the national systems like Abshir or other systems that they have the correct and up-to-date information, that would help. But we should not forget that the counseling itself has two processes. The first one is to notify the donor, but most importantly, actually, is to counsel the donor about his or her results. And unfortunately, this is what, there is a notification, but compliance with the way that we should conduct counseling is, I think, it's need to be improved significantly.
Hello. We can take this question first and then Doctora. Please go ahead. Fadal.
Okay. My question is for Dr. Kalyan, and I'm sorry if I'm pronouncing your name wrong. You mentioned that Bangladesh maintain a 0.01% of HIV disease. Is that number a great number, or is it supposed to be 0.0?
Thank you very much for your question. I think we need to improve the system that we have been using to detect the TTI for the donors. Right now we are doing the ELISA method, but I think in the near future we need to think about the introduction of nucleic acid amplification testing. And still, it's showing that the data is showing that the prevalence is very low, but there may be some hidden positive cases that can be missed out by the current methods we have been using. Because, you know, in the methods where you're using like ELISA or CLIA, they cannot detect the shorter incubation times. Okay, so we need to implement more stronger, more sensitive serological methods like NAT to figure out what's going on. Thank you.
Yes.
السلام عليكم ورحمة الله وبركاته. أروى الريامي من عمان. I would like to start by thanking the speakers for the excellent presentations in this session today. And I do have a comment to share with an experience from Oman, and as well with a question. So with regards to having a donor counselor, actually as part of the National Blood Transfusion Committee in the Ministry of Health in Oman, we did work in 2020 to include the mandate of having a donor counselor in our blood transfusion policy for the whole country. And this was also stemmed from the challenges that you did mention, in the fact that these donors may not have the proper counseling performed in a timely manner. Some of them may actually show up in the blood banks later when they come for the blood donation to discover that they had a positive infectious marker. Some of them can be lost in the follow-up and so forth. So this was actually discussed at the level of the committee, and we have decided to include it as a mandate to have a donor counselor. That being said, I think it is one part to solve the problem, because these donors, after being counseled, they have to be referred to a specialist, and depends on the marker that we are speaking about. They may require repeated testing for confirmation. They may need to be reinstated into the donor pool after medical evaluation. So counseling is only part of the bigger picture, and that's technically requires some sort of a framework of how to handle these donors depending on the marker itself. And depending on the healthcare system setup, you may want to refer them to family physicians or to the primary healthcare system, and have kind of algorithms on how to follow up these patients now, and basically have them referred to a specialist if it's required. And this is especially important for the donors that have a positive marker like for hepatitis B, because it tends to be common in our region, and it is very difficult to absorb them in specialist clinic upfront to have them regularly monitored. But if they can be referred to a primary healthcare setup where algorithms do exist in place on how to monitor these donors and refer them whenever it is really required, I think that's important. And having policies on when to restate them is something that is also important, because we're still challenging in that due to IT setups on how to accommodate donors back, and also acceptance of reinstating donors is still not yet unified. And the floor is for you for comment. Thank you.
Thank you very much, Doctora, for your comment. I agree with you that actually it's always it's the general picture that we should be looking for. And maybe we are lucky here, because we are, for the second point, that regarding the retesting and treating of those donors who has a positive TTI markers, I think we don't have really a problem here in Saudi Arabia, because we have a clear guidelines for that. Once the donor is referred, any treatment or any testing for TTIs should be conducted free of charge. And it's actually handled now by Wiqaya, which is the national health authority we have here. But the problem is actually there is no integration between the blood transfusion service and what happens after that in these hospitals, or what happened for those donors in terms of whether they are confirmed positive, or they may be we don't have like re-entry system now. Even in our accreditation standards, we don't have standards that would allow us to re-enter donors. And we follow either the AABB guidelines or other institutions. We don't have a clear standards for re-entry, donor re-entry. So it's not legalized so far. So we are good in the second step, but you are good in the first one, where we need more work in actually getting the right message to the donor. Because in MOH, for example, Ministry of Health hospitals, most of the counseling, for especially post-transfusion counseling, is done by a third party, which is the preventive medicine, not by the blood bank, which is actually simply, we don't communicate with donors. Sometimes we are not even allowed to tell them, we just, especially for HIV, for example, we just report them to the health authorities where they will continue telling them and etc. So yes, you have really good example for counseling, but I think we need to improve our situations. But once the donor is reported, there is some, I'm sure it's very clear how they will manage it, at least in our situation. But I agree with you. You need to always to have everything, in place. Thank you.
Just a reminder for all, Dr. Noor Al-Muzayin is with us, so in case anyone has a question, she's available online. She can answer the question.
Can I have a question, please? Here. Okay. Abdullah, I have a question for you. She's busy. Okay. I'd like to ask you a question. Is it okay? Yes, yes, please.
I'm just coordinating this, but you want to... Yalla, go ahead, please, Dr. Abdullah.
Usually
this is...
I want to use your...
any question is welcome. Yes. I know that you are so happy to do this, so I'm just accepting any questions.
Thank you. I mean, as I mentioned, we don't have clear standards for, exactly, making the counseling very
For what?
From Sibahi perspective, from Central Board of Accreditation. Do you think that's another, especially for re-entry, any standards that can be a national standards for re-entering donor if they are having a false positive test or indeterminate test?
Sahih.
Do you think it's important, and how we can do it?
So as you rightfully said, Dr. Abdullah, there is currently we rely on resources from abroad, mainly AABB. So these are the only resources that are available. I'm talking about now blood banks. If I want to wear the accreditation hat, now, as of today, the current version NHS 3 from Sibahi lacks some elements, but inshallah, in the near future, we will have a more comprehensive set of standards that is specialized and addresses the exact needs for blood banks and other domains within the laboratory. As of when, that's the question of the hour, but rest assured that at Sibahi headquarters, they're doing their best to meet the expectations and even release the next version, inshallah, as soon as possible. So definitely this is one of the points that are very considered in the next version of the standards, inshallah.
Shukran.
Assalamu alaikum. يعطيكم العافية. Regarding the question you asked, Dr. Abdullah, to Mr. Ja'far about the standards, there is one section in, I remember, in ABB regarding the consent of the donor, that you should explain that there is circumstances will happen if you come as a donor to benefit from the this service of donation to test for serology. Because it's common in United States that donors don't want to be registered or they want to test for HIV or other sexual transmitted disease, so they are going to donation, which is high risk, of course, for the patients. So in a part of Sibahi, regarding this information, we don't mention this for the patient. It's not mentioned that there is a circumstances. if you are coming here to benefit from this service. So should we have circumstances? So do we explain the patient there is, we can explain for the donor, you cannot do this practice, but what is this alternative solution? Because we cannot put, for our hospital, we cannot put circumstances and the national accreditations like Sibahi, they are not mentioned, so it's not unified for all hospitals. So they will seek this practice again. So what is the recommendation to address this point from Sibahi perspective and from you, Dr. Abdallah?
Well, thank you again. لا يفتوى مالك في المدينة. I will refer this question to Mr. Jafar because he's the...
I can see that you are putting a lot of pressure on me today. I'm just moderating
preparing
the
for
session.
tomorrow's presentation.
لا الله يعطيك العافية دكتور. أنت you are a
Because
senior.
Dr. Abdallah, you mentioned there is no clear guideline.
تمام.
So every hospital will address this issue in a different way, but we cannot say that. We cannot mention this clearly for the patient because you are for the donor, because it's like you are telling him that you are not coming here for donation, you are coming here for your personal issue. So how we can address this to be followed with the ABB and to be safe in Saudi Arabia regulations?
Okay, so let me tell you one thing. If you want to hear the answer for this question, come tomorrow to my presentation. Yes. I will be talking about risk assessment. This is most probably one of the things that we should consider in case of absence of any recommendation, any regulation, and you have a need within your lab, within your hospital, what to do and what kind of, which matrix do you follow to assess the importance of what you are looking for and develop your own standards. I will talk about that inshallah tomorrow. I don't want to burn out my slides early. So if in case Dr. Abdallah would like to add anything, please Dr. Abdallah, feel free.
Of course. I will just add another aspect of this is that usually accreditation standards itself does not need to be very detailed to that and contains everything. But usually it is the concept of the accreditation. For example, if you can find that you should give a proper donor information, for example, to reduce the risk of post-transfusion infection. So you can take that as a hint. You can put everything related to that standard, which is best practice. Usually we have accreditation standards, but we have also guidelines and best practice guidelines. So we have to integrate both of them. And I think this is what Mr. Jaffa said, that it's always find a way to get the best service to the donors. If there is no standards, does not mean that you shouldn't do things, but at least you should do the best for the donor until there is a clear update standards in the maybe next. And this is how accreditation standard is actually evolving. It's every time add and change the language, change the content, etc. Yeah.
Thank you so much.
Yeah, thank you all for your valuable answers to the questions. My question is for Dr. Noor Mzayin. You mentioned about the studies or the top 10 or type of number of studies related to the donation and what is the benefit of those studies. So now, after evaluating the studies and ranking them, what would be the impact on the practicality, the regulations, and how they will impact on the people in the field and the regulators to utilize these studies?
Thanks, Mr. Jassim, for your question. Can you hear me clearly?
Hear you.
Okay, so I think the high quality evidence that were addressed in our review as the ones concerning with iron supplementation to donors, whether they're new or frequent, or those donors who are having iron deficiency. And I think that would impact the practice. Now there are some recommendations beyond recommendations, actually guidance from the AABB that iron supplementation, or donors should be counseled about iron supplementation. And many centers around the world have established that. So I think that is the next standard of practice would be in the donor medicine, as the iron screening by ferritin and transferrin saturation and iron replacement.
I have a questions for Dr. Mohammed. Really, we have seen from your presentations, a quick presentations in regard of Damy journey. So, and you grow gradually for voluntary donations. My question is, when you do you have a clear plan to spread around the kingdoms with the same visions? And do you have any agreements with the MOH to take this role in regard of improving the voluntary donations?
Okay, Dr. Musa, thank you so much for this question. I mean, for the future plan or for the expansion, I always get asked by this question from the board of the charity. So once we opened this donation center, they asked me, what's next? They think, well, I said, there are a lot of room for improvement. There are a lot of room to work in. And we get an idea from your side and we implement it. So for the donation center, no, we are not restricted to MOH. Now we have an agreement with the King Faisal Specialist Hospital in Riyadh and other agreements. So it's not restricted. It's focused on blood donation or voluntary blood donation, whether under the umbrella of MOH or other sectors. This is one thing. And for expansion, yeah, we are thinking of expansion. But we need to, really study the feasibility before we open any center, because we got experience now. We got a lot of pressure from some hospitals that they need a donation center. Then once we establish it, once we make it ready, we find that they just operate it one day. This is one of the challenges that we face, that we run our centers through third party. So now we need to do a thorough study about the statistic and the need for any new donation center. Okay.
Any other questions? Thank you very much, Dr. Mohammed. And the rest of the team. I think by this we can conclude the question and answer session. We can go for a break.
Yeah. I have one question.
تفضل.
Okay, also just, to complete my answer to Dr. Saad for the future direction. Now, we need to improve our skills. Now, today we just launched the academy, officially launched academy. So we need to also use other approaches to educate our community. This is one thing. The other thing is, I think in the next year we're going to approach the universities. We're going to focus on university, because they got a high number of students at the age of at the age of 18 and above. And if you recruit a donor at age of 18, I should say 18. At age, this donor will last for next 40 years at least in donation. This is one thing. And the third project that we're working in is to have a research chair, just for sustainable fund for our research. We need to focus on research. If we do any study, we find very few studies on blood donation in Saudi. So we want to get into that, do collaboration with universities to do more research. This is like our and my question to Dr. Abdullah, if you allow me, Dr. Jafar, about like donor counseling, and we heard from Dr. Ali in the first talk that when they asked the donors, they said they spend more time in answering questionnaire. And this is one thing that I'm thinking of to implement in our charity, to do a self-assessment for donors. Would that help, Doctor, to reduce the time? Because this is one thing that, I mean, to improve our donor experience when they come to donation. I'm trying to create like a electronic self-assessment before they come, before they book an appointment with us. Is that helpful, Doctor? Do you think it's worth to do it or not?
From the principle, it's okay to have actually pre-filled donor questionnaire before the donor comes to the blood donation center. But I think there are two things we need to consider. The first one is that there still need to be reviewed with a professional counselor to check the understanding and the accuracy and the reliability of the answers. And also it should be very secured. It means that, because there are a lot of personal answers and details on that questionnaire. So the security and how you connect it to the blood bank information system would be sometimes not as easy as we think. And also I can add that it should, the time that the donor will fill this questionnaire should not be, at least in my opinion, should not be more than 24 hours from the time of donation, because it needs to be filled during, just immediately before the donation. So we have to consider these maybe three things, but it's one of the things that I've seen it in other centers worldwide. They use this type of self-administered questionnaire where the donor can fill online even before he comes to the center. But I think that the security of information, integration this information with the blood bank information system, and also the period between the answers and the actual donation need to be assessed and considered.
Yeah, just to improve our donor experience, this is the thing.
It will definitely improve the experience, especially from young donors, because they like, it's actually very, very feasible in my opinion, but the problem is that it's always difficult to have a hyper-secure integration between an online platform that the donor can fill and also the system that we have in our blood bank. So it's just need maybe proper risk assessment and another interventions for that. Yeah, but of course,
Thank you, Doctor.